Today we will discuss about ultrasound image orientations. Look at the probe. This is the transverse section probe. This is the ultrasound probe having a probe marker. Remember, in every ultrasound probe there is a probe marker present. It may be a diffraction, it may be a elevation, it may be a light, it may be a company name, it may be a company logo, anything else. There should be a probe marker in every ultrasound probe. Remember, this is a transverse section. This is the transverse section of the organ itself. Remember, when you are taking transverse section of a organ, the probe marker should be present towards the right side of the body. In transverse section, we are cutting the organ transversely. That is transverse slice of an organ itself. In transverse section, the probe marker should be towards the right side of the body. Remember, in transverse section, the probe marker should be towards the right side of the body. In longitudinal section, that is longitudinal section with respect to organ itself, not with respect to body. That is, in longitudinal section, we are cutting the organ longitudinally. That is, in longitudinal section, the probe marker, this is a probe marker. The probe marker should be towards the patient's head. Towards the patient head. In longitudinal section, the probe marker should be towards the patient head. Now we will discuss about how the ultrasound image will produce in transverse section, how the ultrasound image is produced in longitudinal section. In transverse section, the ultrasound image which is produced on the monitor, this is anterior side of the organ, this is posterior side of the organ, this is right side of the organ, this is left side of the organ. In transverse section, the image which is produced having anterior side, having posterior side, having right side, having left side. But the image which is produced in case of longitudinal section, having anterior side, having posterior side, having superior side, having inferior side, there is no right side and left side. Remember, in longitudinal section, both in longitudinal section and transverse section, anterior and posterior side remain same. That is, anterior side and posterior side of the organ is visualized, but right side, which is visualized in case of transverse section, is shifted to superior side in case of longitudinal section, and left side, which is visualized in case of transverse section, is shifted to inferior side in case of longitudinal section. Again, at last I am telling, in transverse section, you should prove, in transverse section, you should position the probe marker towards the right side of the body. In longitudinal section, the probe marker should be towards the patient's head. In transverse view and longitudinal view, anterior and posterior side of a organ is produced, but right side changed to superior side and left side shifted to inferior side of the organ. Thank you.